Hi, I'm Lisa Lancaster. I'm a pulmonologist at the Vanderbilt Lung Institute of Vanderbilt University Medical Center, and I'm happy to be with you today. We're just going to talk a little bit about testing for COVID-19, the coronavirus, and decide when to get tested, how to use that information, what tests are out there. So let's start with, when should you get tested? Well, symptoms are, of course, the big driver of that. If you develop signs or symptoms that are consistent with the COVID-19 infection, then that's the first and biggest starting point. If you've been exposed to someone, and that's someone that has had a known laboratory test that's positive for COVID-19, you might need a test for work to be able to go back to work after COVID, or for work travel. Traveling requirements to different countries have fluctuated over time and are less stringent than they have been, but always check out your travel destinations and what the requirements are for getting back into the country if you are leaving the country. Also for event planning. Many people have practiced safe event planning over holidays when they're having large groups get together, or weddings even, and plan to test before that. So as we think about testing, and we think about testing when we're next to someone who's a close and considered a close contact, what exactly is a close contact? Well, it's someone that is less than 6 feet away from a lab confirmed case of COVID-19, and you're less than 6 feet away for about 15 minutes or more over a 24-hour period. So it is kind of a brief exposure, but it is 15 minutes or more, less than 6 feet away over a 24-hour period. So you have a positive test. Which one did you have, and what does that exactly mean? Well, the types of tests include the rapid antigen test and PCR. And we have different varieties of the rapid antigen test, and there are several on the shelves at the drugstore. But just some interesting things to note. Intermittently, we've had some free tests available to us that you could sign up for through the government and get them in the mail. Some available at local health departments for free. Check also with your insurance. I've been surprised about how many insurance companies supply a certain number of rapid antigen tests to their clients every month or so. So check into that. A lot of times your pharmacies can look that information up for you. And then there's also the more sensitive PCR that is available mainly at healthcare centers. So one thing to know about the rapid antigen test is that it can be falsely negative. If you have symptoms that are highly suspicious for COVID-19, and you've had one negative rapid antigen test, and you do another one a few days later, and it's still negative, but your symptoms are very suspicious, get that PCR test done, because that's going to be more sensitive for picking up your disease. Now, false positives can occur too, but those are more likely to occur only if you use the test incorrectly. Inappropriate storage, reading the results too late outside the window when you're supposed to be reading them, or even use in a low prevalence region has been listed as a risk for that. But mainly the risks have to do with inappropriate use. So you have a positive test. What should you do next? So over this 2-year period, we've learned an enormous amount about this particular coronavirus and the disease that it causes. So there's been multiple adjustments as we go along, and be prepared to be flexible and make more adjustments as variants change, and plans and recommendations and therapies ultimately change. But for now, look at the CDC website for the latest information. Presently, it's isolate for 5 days. If you have a positive test, you can come out of isolation but wear a mask the next 5 days if your fever's gone for about 24 hours and your symptoms are getting better. If you are very sick or immune compromised, then you might need to isolate longer. Touch base with your physician. I hope you found some pearls and positive points to take back to your practice regarding COVID-19 and management and diagnostic strategies. Thanks for joining.